parotidectomy, the parotid gland is one of the major salivary glands. These glands are present on the cheek in front of the ear on both sides of the face. The gland can have multiple diseases by which it can cause increase in size or pain. The common being an infection like mumps or any other bacterial infection, or presence of a stone in the duct or blockage which is called a silolith, which can cause blockage of the duct, causing increase in the size and pain. The other conditions that can cause increase in size of the gland are tumors and cancers. The commonest swelling or tumor in the parotid gland is a pleomorphic adenoma. It's a benign tumor which grows slowly in the gland and increases in size. The evaluation of a parotid swelling involves mainly two steps. One is to evaluate it by a radiological examination, which would be a minimal would be an ultrasound. Definitely in a tumor or a cancer, we would like to go for a CT scan or an MRI. MRI would be the best preferred among these to perform evaluation of a parotid gland. The next step would be to perform a fine needle aspiration cytology or a simple needle test from the nodule or the swelling to identify what type of swelling it is. This gives us a clear picture of whether we are dealing with a benign condition or we are dealing with a malignancy or a cancer. Once we reach a diagnosis, the treatment of all benign and malignant conditions of the parotid is removal of the parotid glands called parotidectomy. In a benign condition, maybe the requirement would be to remove a part of the gland or called the superficial lobe or the superficial parotidectomy. In a cancer, it would be removal of the complete gland called the total parotidectomy. The distinction between these two is because of presence of a very important structure inside the parotid gland called the facial nerve, the nerve to the face. So any injury or trauma to the gland can lead to paralysis or decreased movement on that side of the face. So the facial nerve is one of the most critical structures inside the gland which needs to be preserved while performing the surgery. Parotidectomy conventionally is performed by an incision which starts from in front of the ear and goes down to the neck. Various surgeons have performed other techniques by trying to reduce the size because of the incision right in front of the face, which may be visible. There have been smaller incisions tried, and people do perform smaller incisions, parotidectomy. We have started performing a small incision or a micro incision parotidectomy since the last few years with excellent results. This incision cannot be visualized and is taken just behind the ear. It's a 2 to 3 centimeter incision behind the ear in the groove in the ear. So after the surgery is over, the incision is not seen at all. For the past 4 to 5 years, we've been performing a large number of cases of both benign and malignant cases of parotid tumors and cancers by this mini incision parotidectomy with excellent results. The goals of a good parotid surgery are definitely to remove the disease, to remove the tumor or the cancer. There's no compromise to that. The next is to have a good cosmesis. That is, to have an incision which is not seen, and definitely preserve the facial nerve function. Our technique of mini incision parotidectomy has multiple advantages. One, definitely there is no unsightly scar in front of the face or the neck. It involves a small incision behind the ear, which is completely hidden. The recovery from the surgery, the next day morning the patient can be sent home. There are no bandages on the face or the neck. The return to work is immediate and the patient definitely has a good quality of life.